Thank you for joining us for this special webinar series highlighting the new 2014 research grants funded by the AKC Canine Health Foundation. In all, 17 grants were approved, totaling nearly $1.5 million for canine health research. These projects cover 10 unique areas of canine health. In each of the short videos in this series, CHF's Chief Scientific Officer, Dr. Shila Nordone, explains the proposed work, significance, and impact for each grant, and how these projects will work together to move canine health forward so that all dogs can live longer, healthier lives. We hope you find these webinars to be informative and exciting. Please visit www.akcchf.org/donate to show your support for our funded research. In this session, Shila will be discussing our new grants within the Cardiology Research Program Area.
One of our major areas of emphasis is our Cardiology Research Program Area, and this is a substantial program for us. We have quite a few grants funded in this area because it is one of our donors' largest concerns. So the Cardiology Research Program Area is designed to support integrated basic and clinical research, to support normal and abnormal cardiovascular development research. And we have a very wide breadth of studies that we will fund that include heart development, structural disease, understanding arrhythmias, improving diagnostics and therapeutics, enhancing surgery, and ultimately enabling technologies that can be used in discovery research, bioinformatics, computational and systems biology approaches, a lot of the new and novel areas that are emerging to help us better treat dogs with cardiac disease. One of the things that we've tried to emphasize is that research does not work in isolation, and each study that we fund becomes a building block towards increasing our understanding of a particular disease, so that in the end, once we have all our blocks assembled, we can understand a disease so thoroughly that we can prevent it, or we can have novel therapeutics that will help us control disease. So in order to build breadth in the area of cardiology research in the dog, we've focused on some of the bigger problems: mitral valve disease, cardiomyopathy, arrhythmia, and pulmonary hypertension. And our goal is to come at these cardiology problems from multiple angles. So we are looking at funding improved therapies, and some of these may be where we're using existing drugs to improve the care of dogs with cardiac disease. We're looking to fund research that will help us diagnose disease early and accurately. We can do this through identification of biomarkers or biological markers that define cardiac disease. We can also improve some of our imaging technology. And we're also looking to fund cutting-edge new therapies, such as the gene therapy grant we funded last year. Ultimately, once we come at these different problems from all of these different angles, our goal is to have genetic markers of disease, and that will help us improve some of our breeding programs to prevent the disease from occurring in the first place. The first grant that we funded in our Cardiology Research Program this year is Grant 1994, Early and Accurate Prediction of Mitral Valve Disease Development. This grant is by Dr. Sidney Moise at Cornell University and was funded for $36,881. The focus of Dr. Moise's grant is myxomatous mitral valve degeneration, or MMVD. A dog's mitral valve opens and closes 120,000 times per day and is under a constant barrage of mechanical forces. And so the estimate right now is that 75% of heart disease is caused by myxomatous mitral valve degeneration. Dr. Moise hypothesizes that dogs with MMVD have an altered structure of the mitral valve apparatus, and that this might be linked to breed size and/or cartilage development. The goal of this MMVD study is to use a computer algorithm to assess the motion of the mitral valve leaflets and define the mechanical signatures of the mitral valve. These signatures, she thinks, will be identifiable at a young age in the breeds of dogs that are most commonly affected with MMVD. And she believes that a quantitative understanding of mitral valve mechanics will improve our ability to predict mitral valve disease susceptibility and increase the power and resolution of gene mapping efforts by improving very early phenotyping of affected dogs. We also want to point out that Dr. Moise's study strongly complements an existing ACORN grant that we have right now and that is active in our funding portfolio, Grant 1866, Enhancing Treatment of Mitral Valve Disease through the Identification of Biological Markers of Disease. The PI of this grant is Dr. Ashley Saunders. She is at Texas A&M, and again, this is an ACORN, so $12,960. But again, you can see how we have an imaging study that's going to be working together with a biomarker study to start to understand disease better. Another newly funded grant in our Cardiology Research Program Area is Grant 1982, Personalized Medicine, the Intersection of Genotype and Drug Responsiveness in the Treatment of Canine Pulmonary Hypertension. The principal investigator is a new investigator, Dr. Josh Stern, who is at UC Davis in California, and the total grant amount that we funded was $27,971. So pulmonary hypertension is unusually high blood pressure in the blood vessels leading to and passing through the lungs. And in dogs that have pulmonary hypertension, we see insufficient reoxygenation of blood. These dogs are less energetic, less able to exercise, and show shortness of breath. Sildenafil, also known as Viagra, is the drug most often used by veterinarians to treat pulmonary hypertension, but the problem is it does not always work. So Dr. Stern believes that there might be a unique DNA signature of an individual that is determinative of their ability to respond to sildenafil. So the goals of this pulmonary hypertension study are to identify whether or not there is a mutation in a gene called phosphodiesterase 5A, PDE5A, and he believes that this will be identified and that ultimately this will lead to personalized therapy for pulmonary hypertension. And once we can identify which dogs are responsive to sildenafil or are not responsive, this will force us to search for new drugs to treat individuals who we know are genetically unable to respond to sildenafil. Another new grant in our Cardiology Research Program Area is Grant 2046, using a novel combination of drugs to treat arrhythmia and heart failure in dogs. The principal investigator of this grant is Dr. Janice Bright. She's at Colorado State University, and we funded this grant for $33,060. The focus of Dr. Bright's grant is atrial fibrillation, or AFib, and this is a common heart rhythm abnormality in dogs. Arrhythmia affects all breeds of dogs, and unfortunately, it frequently coexists with heart failure and causes worsening of disease and increases mortality. So the goal of Dr. Bright's study is to look at a drug combination that she thinks will improve outcomes for dogs that are suffering from AFib and heart failure. She's going to look at the responsiveness to two drugs. We're going to have to start over with this because it's amiodarone. The goals of Dr. Bright's study is to look at a specific drug combination to see if it improves outcomes for dogs suffering from AFib and heart failure. She's looking at their responsiveness to two drugs, amiodarone, an anti-arrhythmic agent, and ranolazine, a drug that's used in humans with coronary heart disease. She's going to determine whether ranolazine given with amiodarone prolongs normal rhythm compared to amiodarone alone. She will determine whether ranolazine also improves heart function, and the results of this study will validate a combination of using ranolazine and amiodarone administration to improve treatment for dogs with AFib and heart failure and hopefully extend their quality of life. Dr. Bright's study will complement an existing ACORN that we have funded, 1859, defining the significance of irregular heartbeats through early monitoring. The principal investigator of this grant is Dr. Robert Sanders at Michigan State, and again it's an ACORN funded for $12,723. The goal of Dr. Sanders' study is to evaluate the frequency and complexity of ventricular arrhythmias, and his goal is that through enhancing our understanding of arrhythmias will lead to better long-term consequences for dogs with ventricular arrhythmia. Two grants that we have active right now in cardiomyopathy that were funded last year, Grant 1753, Identification of Genetic Factors that Alter the Severity of Cardiomyopathy. The principal investigator is Dr. Kate Mears at North Carolina State. That grant was funded for $73,343. And grant 1760, use of gene therapy to treat dilated cardiomyopathy. The PI of that study is Dr. Meg Sleeper at Penn, and that grant was funded for $146,774. So as you can see, we now have a very nice, robust cardiology portfolio that covers all of the major canine cardiac diseases.
For more information and to support these grants, please visit us online at www.akcchf.org/2014 grants.